Stay right there.
Can you give her a mic check, please?
Testing 1, 2, 3, 4.
You're going to talk about the
Incoming information from Clay County Sheriff. Coronavirus.
I'm good.
okay.
I think so.
Just, I mean, they're
Yeah, we did our roll call.
This discussion about our long time. Like,
About we are live now, so just for you.
how about her that's
Glare?
glare?
No. Oh, a little bit. A little bit. It's the windows.
Can they see you stand? Can they see her standing now? People
Standing.
can see her standing there.
Yes. Yep.
She didn't have his live.
She can walk off if she wants, if she's more comfortable. And then walk back on when everybody comes. Perfect.
I will.
That's what I think. I figure I relay those.
Yes, sir.
Morning, sir. How are you? Top of the game. How about y'all?
We're about the same.
Good to be ready.
Yes, sir.
Get ready. Ready.
Am I waiting on someone to cue me or just go ahead and start talking? Good afternoon, ladies and gentlemen. My name is Gaylord Hendry. I'm chairman of the Clay County Commission, the Board of County Commissioners. I'd like to thank everyone for coming out today, especially for our media partners. They have been very faithful to meet with us whenever we needed them to share the information and get the word out to the public. That information that's sometimes is life-threatening, so we appreciate them coming out today to be part of this. Again, I would just like, this is the fourth in a series of press conferences, and I'm hoping that maybe we won't have to have that many more. So when we stop having these press conferences, you know things are getting much better. I want to assure the residents of Clay County that we have the very best team in place to lead the county and our citizens through this crisis of COVID-19. The Unified Command being the Board of County Commissioners, the Clay County Manager, Clay County Division of Emergency Management, and the Florida Department of Health in Clay County are leading this team. Our speakers here today are here for one purpose. That's to share with the citizens of Clay County information that they need to get through this crisis. And we just expect them to share, to keep continuing to share this until this hideous ordeal is over with. Our team is constantly addressing the critical needs of the community and executing the plans, be it supplies or be it assistance or even information to help the citizens of Clay County get through this. And just to keep this in perspective, folks, I was flipping through my emails earlier today while I was sitting outside there waiting. We've had 3-4 deaths in Clay County, I believe, several hundred nationwide. But today, this is the perspective we need to lead with. There will be, on average, 3,700 people killed in the United States car accidents. 3,700 in one day, which amounts to 1.3 or 4 or 5 million people in a year. So, as bad as this is, and I'm not trying to minimize it, because if you lose a loved one, it can get no worse. But you know, there are other things out there that we deal with daily that's much more dangerous than the COVID-19. So I want to share that fact with you so you can kind of keep it in perspective. This time I'd like to turn it over to John Ward, the director of our Clay County Emergency Management Team. John.
Good afternoon, everybody. John Ward, Director of Emergency Management here in Clay County. Here at the EOC, the Emergency Operations Center, where we have unified command with our partners with the Department of Health and all our other response agencies that are here within the county. And for those of you that have heard me talk before, I want to emphasize the partnerships we have and how thankful we are, whether it's the Department of Health, Fire Rescue, Sheriff's Office, Emergency Management. These partnerships are what's making this so successful here in Clay County. One thing I want to pass off is Heather. When she comes up, she will talk about the numbers. They will grow. I want everybody to be assured of that. They will grow, unfortunately, but what we need you to continue doing is your social distancing and the avoiding the large groups. Our county parks are still open. It's beautiful weather out there to get out to, but we're seeing some folks start to get complacent and start to gather back in those groups. We need to make sure and stay away from those groups so our younger generation is not going to contract this and pass it on to our more vulnerable populations. I want to talk about the human services lift that we have here in Clay County. This is becoming a very large human services lift, which is a feeding operation. Clay County Emergency Management is working to support our 6 major food banks within the county, and we've set up a distribution warehouse, and we are receiving commodities, and we are pushing that out, and we have a plan for sustainment long term to do this. As we continue in this, the feeding need is going to grow, and we understand that, and we've been working with our partners at the food banks and many other organizations to do this in a coordinated effort so we can continue to sustain this. We have a distribution warehouse set up. We're receiving truckloads of food, and we're pushing that out to our respective food banks as we move forward. For any of our folks that would like to do donations, they can either go to their local food banks or they can coordinate with our Human Services Division by calling 877-252-9362 to help receive those donations, and we can push them out accordingly. Just wanted to we've been getting a lot of questions about testing. The regional testing site is still in Jacksonville at TIAA Bankfield, my apologies. And that is open from 9 to 5 or until they meet their 250 tests per day, which is generally sometimes mid-afternoon by the time they do that. That is a regional testing site, and that is where we're pushing a lot of our folks to. One thing I just do want to say on a side note is that if you test positive, they're sending you home to stay isolated for 14 days. So I kind of just want to think, if we're sick, stay home unless you've got severe respiratory issues. If you're sick, stay home so we're not spreading this. And then as I always say, I want to continue to say, please be sure you're getting the correct information, and that's either from the CDC website, the Florida Department of Health website, our local Clay County BCC website, and then also the Clay County Emergency Management social media pages for the most up-to-date and accurate information. And then our call center. If you've got any questions, please call our call center at 877-252-9362, and that is open 7 days a week, 8 to 5 every day. I'm going to turn it over to Ms. Heather Huffman, who's our partner at the Health Department, to go ahead and further brief.
Good afternoon. Thank you, John. Thank you for your support during this event, and
to all of our other respective agencies. So I want to give you a little bit of information on the data that we have currently. We have, before I came here, we're at 20. I know we had reported 22, so the reason I want to go over that data is because as we begin case investigation and as we start beginning the process of contact tracing, sometimes individuals may have been tested in our county, so that maybe that comes back from the hospital or the provider's office within our county, so we believe at the original time of reporting they are our case. Once we realize that they are an actual resident of the other case, we then move that case into the respective county of residency. So you may see numbers go up and then they may be corrected by the end of the day as numbers get reported later in the day, and then you may have those corrections the next morning. So I wanted to explain that to you, how those numbers could then reduce. It's not that there is another, that a case has dropped off and it wasn't a case, that case got moved simply to another county. So I wanted to be very cognizant of that. On March 25th, the State Surgeon General, Dr. Scott Ribkees, issued a public health advisory that was under Executive Order 20-83, specifically about vulnerable populations, and specifically stated all individuals over the age of 65 and any individuals of any age with high-risk conditions should remain in their residence and take all measures to limit the risk of COVID-19. These measures include limiting contact with all persons outside of the home and distancing any unavoidable contact at a minimum of 6 feet, washing hands with warm and soapy water for at least 20 seconds, and or using hand sanitizer with at least 60% alcohol, and of course avoiding any touching of your face, including eyes, nose, and mouth, and washing hands before doing so, and then cleaning high-touch surfaces and disinfecting, including doorway handles. High-risk conditions were specifically addressed in this public health advisory, and those include but are not limited to chronic lung disease, moderate or severe asthma, serious heart conditions, anybody that has any kind of immunocompromised status, such as those that have gone through recent cancer treatment, bone marrow transplant, organ transplantation, anybody that has immunodeficiencies or poorly controlled HIV status or AIDS, and those that have had prolonged use of corticosteroids or other immune-weakening medications. Cancer, individuals with severe obesity over 40, diabetes, renal failure, and liver disease. In addition, in that public health advisory, Dr. Ribke spoke about the gatherings of private citizens, fewer than 10 people, and then he also directed businesses to look at telework options and reducing their workforce to 50% if possible in order to maintain social distancing. So John talked about our testing. Our regional testing site has not changed. That continues to be in Jacksonville at the Lot J at the TIAA Bank. That is for any individual of any age. There are certain criteria, 99.6 degrees temperature, so please do not use fever-reducing medications 4 to 6 hours before going, and you must have some type of respiratory illness. You must show some form of ID. Healthcare providers and first responders can go there without any signs and symptoms or fever. They just need to simply be able to show their work badge in order to get tested. So I want to talk a little bit about testing and what that means. We have to remember there is no treatment and there is no vaccine for this. So again, even if you test positive today, the simple message that it will be, if you are not in respiratory failure or having major respiratory issues, you're still going to be asked to isolate at home. So we want individuals to isolate at home. If you're feeling ill or sick, especially isolate yourself. You may even need to isolate yourself within your own home to a bedroom so that you're not infecting the other members of your immediate family. And again, if you feel like you're at a point that you need emergency care, to seek that service at the emergency care, identifying that you're having respiratory type illnesses. And at this point, I'm going to turn over the messaging to Daryl Daniels, our sheriff.
Thank you. Just a couple of brief updates from the Sheriff's Office. We're restricting access to all of our facilities. Unnecessary visits to the facilities will be turned back. The phone numbers for our lobbies in all these areas are as follows in Green Cove: 904-529-5904. In Middleburg, 904-213-6120. And in Orange Park, 904-213-6600. So if you need access or need some assistance from someone in one of our facilities, those are the numbers that will be provided to the media. They'll be posted on our website so that anyone can have those numbers. Some of the things that we're doing at the Sheriff's Office, the things that I spoke to the last time we had this meeting, we are screening all of our employees and inmates who enter into our jail. We have now enacted screening all employees who walk into our facilities, and we are solidifying our staffing contingency plan in the event that we have to scale down our operation. That is a contingency plan that we'll have in place. Someone asked a question whether or not the sheriff's office was out working because they hadn't seen us much. We have canceled all community engagement events, but we are fully staffed on our patrol and detective functions. So the men and women of the Clay County Sheriffs are out there fighting crime, the traditional crime fighting that you would expect. It's just that the community engagement pieces have been scaled back until further notice. And so the next person that you'll hear after I'm done will be the mayor of the town of Orange Park, Connie Thomas. And I'll say this, you know, you're hearing a lot of stay in place. Folks, you're safer at home, where you can control your own environment and the cleanliness of your environment. So you're safe at home. Remember, you have folks out here who are concerned about you and your well-being. And you have folks who are out here in crisis mode because their main source of income has been discontinued as a result of the plan for addressing this issue. So pray for your families, pray for your friends, and pray for your neighbors, and don't forget to check on them. I believe one of the county commissioners spoke to that the last time we were up here. Pray for each one of us. Mayor?
Thank you, Sheriff Daniels. I want to thank our community for reducing the surge buying. Our grocers are telling me this morning that that is happening, but it's not where it needs to be yet. We need to continue to not surge buy, buy just what you need. And like I said last time, if you need to buy a little bit more, then put it in the box for a food bank. We have plenty of groceries to go around. The trucks are coming in as scheduled, and the grocers are very pleased at how that's coming along. I want to take a moment just to thank Feeding Northeast Florida, Waste Not, Want Not, Farm Share, our local food banks, and the many faith-based organizations and citizens that are coming together to serve our Clay County residents. We could not be more pleased with that. All that emergency management has brought together has just been stupendous. So we are really doing all we can to be proactive and to meet the needs of our county. If you need assistance, please call our Emergency Operations Call Center, 877-252-9362, and they're there ready to help you with your needs. So thank you so much. And now, Superintendent of Schools, David Broski.
Good afternoon. Clay County Schools will begin distance learning starting Tuesday, March 31st. This week we've been delivering Chromebooks to parents who need electronic devices at home in order to continue their education. If parents still are in need of a Chromebook, they can go to our dedicated website at oneclay.net/coronavirus in order to register for that. I want to give a shout out to the team of individuals who are there at the school to deliver those devices. They were done in a way in accordance with CDC guidelines. Parents simply pulled up in their car and we actually delivered a Chromebook through their car window to them for them to use with their child. We understand that internet access is an issue related to home education. We have a list of vendors that are giving free internet access, as well as other ideas, such as bubble zones around schools for internet access. That information is also on the oneclay.net coronavirus. I want to point out, this is the first time in U.S. history, in the history of the state of Florida, and certainly in Clay County, that we've ever shut our school system down, and we went from one mode of education to another. Whereas before, students came to the brick and mortar school, had a teacher in their classroom. Now we're saying we're totally changing the way that education is done, and it's going to be done at home. Let me say by reassuring parents and all stakeholders that this is a process. We're not going to turn on a computer at 7:30 on the 31st and the whole world will change. I tell principals, I say, treat this like it's your first day of school in August. It's the first day back. And of course, there'll be some logistical issues that go with such an event in the school system. We serve 39,000 students and those families, and I know that the Clay County School District offers reassurance to folks in such a wide variety of ways in addition to education. Clay County Schools will be having breakfast and lunch for students on school days, breakfast 8 to 9, lunch 12 to 1. We've added 3 locations. The 3 additional locations are McRae Elementary, Middleburg Elementary, and S. Bryan Jennings. They go in concert with Keystone Heights High School, Charles E. Bennett, W.E. Cherry, Ridgeview Elementary, and Wilkinson Elementary. We of course are looking for additional ways to serve the needs of our students and families out there, not only through foods to food banks, but we also want to be cautious to stay in guidance with the CDC for the gathering of individuals and trying to prevent the spread of the disease. So I want to thank you very much for the partnership with the EOC, Emergency Management, and all of the county leaders. It's been tremendous, and together we'll get through this. At this time, I want to introduce County Manager Howard Wanamaker.
Good afternoon, ladies and gentlemen. As of 8 o'clock this morning, our local state of emergency was extended another 7 days until the 3rd of April. The county buildings and also municipal buildings remain either closed or limited access to the public. We ask that before you venture out, please call the switchboard at 904-284-6300. You'll be directed to a particular department or constitutional office. You can either make an appointment or they will help you in whatever service or business you want to conduct with the county. We also remind you that through April through 13th, all board, committee, and county meetings have been canceled. We also have our senior centers are closed to all public access, all 4 of them throughout the county. We are providing to-go meals from 11 to 1 at all 4 facilities for registered seniors. Those seniors that cannot make it out there can call 904-284-3134 to schedule either a frozen or a shelf meal, prepared meals for 7 days to be delivered to your residents. For those seniors that are 60 or older and they qualify, you can also call that same number to register over the phone. And I want to stress that to you all. We identified this and wanted to make sure that that food was also available. You must register first, however. Again, that number is 904-284-3134 for those who would like to register and just answer a few simple questions over the phone. Curbside collection. As we mentioned at the last meeting, we ask you to take max advantage of curbside collection if I go into Rosemary Hill or pickup facilities, or drop-off facilities, I should say. We ask that you bag your household waste, and we ask that you, the night prior, put it out to the curb. This will help minimize exposure and any interaction between you and the sanitation collectors. We also want to talk about parks with you all. As John had mentioned and some others, all county parks other than the town of Orange Park are open for use. Okay, we ask that you refrain from any organized sporting activity that may be planned that you have going on. Again, the parks are open for individual use through sundown. And we took a look at also just if you need to use a restroom or water fountain, please make sure it's clean. Wipe it off, ensure it's clean for your use. And that goes the same for playground equipment for your kids. It'd be real easy just to wipe off who's used it prior to you and to make sure that it's clean. As we go into the weekend, we ask that it's predicted high temperatures, beautiful weather out there. Again, you must remain vigilant and social distance and minimize your social interactions throughout the weekend. It's key and critical. Each and every one of us has a part in preventing this spread. Okay? As you've seen the numbers and the delta each day, we want to reduce that delta and eventually start to go down from there as those individuals get healthy. I thank you, and now I'll bring back up Chairman Gaylord Henry. Thank you all.
Thank you, Howard, and all the good folks that came out this morning. We're gonna get through this, and it's gonna be done quicker if we work together, looking out for the most vulnerable people in our community. And all of you know who they are. Now, one good thing about this is not rocket science, folks. This is real simple stuff that we all need to do to take care of ourselves, our families, our neighbors, and our loved ones. So these directions have been put out multiple times a day, as far as sequestering yourself from groups, washing your hands, staying home if you're sick, and probably not a good idea, or a good idea is just to stay home anyway unless you have need to go out. Watching the news last night, there were seeds of information that was put out that gave me an optimistic outlook on where we are. So I think we're starting to see things that we can consider positive in nature, and look for those. Don't be a doomsdayer about this. Be cautious, but there's no need to let this give you a mental anguish and mental stress. So just stay with the program and do what you need to do per instructions, and we're gonna weather the storm. We are. Are there any questions that our staff could answer for us today before we conclude this press release? Any questions at all?
I have a question, and
Yes, ma'am.
I'm not sure who, so in Duval County, there was a mandate, to work from home. Are there any plans for a mandate similar to that to happen here in Clay County?
John, I know this has been asked before and partially answered. I'm not sure we fully answered it.
So there's not been what we call a governmental mandate to do that, as what you saw in Jacksonville. What we have asked is just we've had many conversations with our utility providers and our other big businesses in the areas if they have the ability to work from home to do that. And we are seeing that happen, but there's not been a government mandate per se to do that yet.
Anything else? It's a good question. No other questions? So this press conference is now concluded. Thank you so much.